Hi, I'm Dr. Jabin Moore. Today I'm going to be talking about acid reflux. It's a question that comes up in my clinic all the time about why do I have acid reflux, what are the causes, and how do I get well? So I'm going to get into this a little bit here just to get started. Stomach acid is always the first piece when you go to your medical doctor and you say, I have acid reflux. They're going, well, you're pushing acid up and it's going to burn your esophagus. It can even lead to cancer. But the reality is when you look into some of the research, when you look at the solutions to the problem, more often than not, we find that it's not high stomach acid, it's actually low stomach acid. Now, the medications out there will reduce your acid reflux by decreasing stomach acid, but that will decrease your ability to digest food, leading to different other symptoms, even whether that be malnutrition, allowing for bacteria, parasites, and other organisms to get into your digestive tract and cause further damage, leading to even more kinds of symptoms. So we want to make sure that we're getting to the root cause, not just simply band-aiding something that can lead to other issues. So if we're going to increase our stomach acid, we've got to make sure, one, we're eating proper nutrition. So we have a good, clean diet that's not too alkaline, because in times, if you go too alkaline, you're actually going to reduce your acid in your stomach. We also need to make sure that if we're not drinking constant alkaline water into a body that's already doing well. So this is for those people that are eating very cleanly already. We just have to make sure we're not going overboard with the alkaline diets. I've seen this before. It's not super common out there, but it's possible. And then lastly, infection. Do we have infections that are leading to reduced stomach acid? Do we have other inflammatory reasons for our digestive tract not to work well and the body to not be producing enough stomach acid? So that's where we got to look. All right, food allergies. So food allergies, that's something that you can talk about, because food allergies going in the digestive tract are going to cause a lot of damage. You know, you're looking at things like celiac disease, where the intestinal villi get damaged. That is going to decrease your stomach acid as the damage continues to build up on your digestive tract. So what can you do for things like this, like food allergies? Well, one, we've got to get rid of these autoimmune-like reactions. So it's not technically autoimmunity, but it's autoimmune-like because your immune system is attacking the food, the collateral damage being your body. So we've got to cut those food allergies out. We've got to make sure to get down to the root cause of food allergies, which is listed below down here. We're going to get to that once we get there. So the next piece is, do we have enough bile being produced in the digestive tract? So you produce the bile out of the liver into the gallbladder, and it stores in the gallbladder. And if we don't have enough bile, then we're not going to break down fats well enough. We're not going to clean out toxins well enough, and it's going to back up. And then when you eat food, especially fatty food, it's going to cause some different symptoms such as acid reflux, bloating, and pain. So what do we do for that? We can take things like TUDCA, we can take ox bile, we can increase our omega fatty acids, and of course, we can detox ourselves and clean the body out. I have seen even long fasts help with reducing toxic load, allowing for the liver and the gallbladder to have a little bit of rest. Next, parasites. What are parasites? Well, they can be those scary worms that people think about, but they can also be small parasites that can even live with inside your cells. So what do we do for those? We've got to go after, we got to do a protocol. We've got to clean them out of the body, which is going to reduce inflammation and stress. It can affect your symptoms from your autoimmunities, from your acid reflux, from your fatigue, to your body pain. So if you've got parasites, which if you've got food allergies, you probably got parasites. If you got acid reflux, you probably got parasites. So it goes back down into what organism, what is root cause? It's either an organism or a toxin, all right? And lastly, bacteria. You've heard of H. pylori possibly. H. pylori is going to cause ulcers in the stomach, but could also be in correlation with some acid reflux symptoms. There's things like small intestinal bacterial overgrowth, which is called SIBO. Both of those need to be cleared out if you're going to get rid of your acid reflux, if that's what you've got going on. So there's a lot of reasons for acid reflux. I've got these 5 here. There are more. There's lots of supplements out there that are Band-Aids. You can use quercetin as a Band-Aid. You can use turmeric and resveratrol as Band-Aids. Those bring down inflammation, which can help with acid reflux. You can take digestive tract enzymes, which help with acid reflux because they give you that enzymatic function to break down your food. You can take HCl, which is hydrochloric acid. It's a supplement you can take, and that can help you to digest your food better. But those things are Band-Aids that are just waiting for you to get to that root cause right here of toxin infection. Get to that root cause, get rid of it, heal the gut, and then allow yourself to be off all the supplements where you don't require the enzymes or the HCLs or any of the gallbladder supports here. So I hope this was helpful. This is my acid reflux video. Share it out if you know somebody dealing with acid reflux. Share it out if you know somebody on medications for acid reflux, because they don't have to be. They don't need the side effects. They can do it on their own in their own healthy body if they just simply get to that root cause.